Good afternoon, it's Mark Larson. It's Friday. I'm here to talk about COVID-19. So we are still in phase 3, but it doesn't mean we couldn't be pushed back to phase 2. So the key is remembering to do the things that we should be doing, which is today is the day that we have to all be wearing a mask. We'll talk about that a little bit at the end. I'd like to talk a little bit about social distancing and not go into parties. So we have two current situations where multiple people that have been to two different parties are positive for COVID-19. One was a birthday party and the other was a party up in the hills. Those things, although technically are okay to get together with people in groups of less than 50, when we go out and we're in groups of less than 50, we still are exposed to disease. So the key is, if you need to have an event and you're going to get together, make sure you're wearing a mask. You should still be maintaining social distancing. And as we move forward and try to move forward and get back to school starting and having things like the rodeo and the fair and those type of things, we need to continue to maintain social distance, 6 feet. We should not be going to events if we don't have to go to events, even though we can, and we should be wearing a mask when we can. So for those of you that can't wear a mask, you do not need to have a note from your doctor. You do not need to buy a pass off eBay that says that you can't wear a mask. Nobody's going to ask you if you can and can't wear a mask. We are just asking again for people to wear a mask. We need over 80% of people to wear a mask to have it be effective. And when we wear a mask, we are protecting others from us. So the whole reason we're wearing a mask is to be kind and to protect others. So remember that. Let's go to some questions.
If I'm working alone in a store, should I be wearing a mask when customers are not present? It's not a high volume environment. Most of the work I do when customers are not present occurs in an area that's separate from the retail store.
Yeah, so based upon the law, if you are not in your own private office, you need to be wearing a mask. You can use common sense and take the mask off if you feel like you need to take the mask off. But the more that we're wearing a mask, the less disease we're spreading to others.
Can you talk a little bit more about contact tracing as far as in phase 3, we're going to see more disease most likely. What happens with contact tracing? Is there an issue with them and putting us back to phase 2 if we don't have enough contact tracing?
Yeah, so, and I think there was some extra parts of that question that I remember. So when we have somebody who is sick with COVID-19, with COVID-2, the virus that causes COVID-19, we call that person and we look backwards 2 days from when they first became symptomatic to try to figure out who they might have been around that could have been exposed. A lot of the time, we cannot figure out who the actual person that gave that person the disease. That's not what contact tracing is. Contact tracing is trying to figure out who's at risk, who that person themselves put people at risk. And so we are doing all of our contact tracing here. We are contacting all of the close contacts of the people that were positive. Sometimes people don't always tell us all the people that they know because sometimes they forget. So somebody else might give us a few other people to call. We have not reached what we call surge capacity here in Kittitas County. So we're able to contact all of our cases and contact all of our close contacts. And we do that daily until those people are cleared. If we would all of a sudden have a whole bunch of extra patients that we weren't able to contact on a regular basis, we would call in people that we've trained for case and contact investigation. Some of those are people that work for the county or for some of the cities that are not currently working. We might use some folks from Central to do case and contact investigation, and that would be what's called surge capacity. So we have the ability to do that, and if it really got bad like what's happening in Yakima, then we turn some of that case and contact investigation over to the state. It's always easier to do it here locally when we know what kind of resources people need to be able to stay at home.
Given that Kittitas County is in phase 3 and many CWU students will be arriving in September from counties in phase 1 or 2, have you considered requiring that they self-quarantine at home for 2 weeks prior to arrival in Ellensburg and or requiring COVID-19 testing upon arrival?
Yeah, so the COVID-19 testing on arrival is probably not overly helpful because all that tells us is that they don't have COVID-19 that very same day. So it doesn't really give us, it gives us false reassurance actually. So there's not been any serious talk about doing that. There's also not been talk about quarantining those people when they come here originally. Lots could change between now and then. There's some talk about people isolating themselves at home prior to the time that they come here to Kittitas County. So there's some talk amongst the folks at Central that's saying, you know, if our football players are coming out here, they need to stay home for 7 days in King County or wherever they are before they come here, and then they would be isolated for a short while here. There is some discussion about testing athletes when they come over, because athletes obviously, especially things like football, those folks are close contact with each other, and they are trying really hard to figure that out.
Last question. In the healthcare setting, should patients be required to wear masks in the inpatient room setting or home health and hospice setting? These really are not public places.
Yeah, those are two separate things. So inpatient, those people are already in isolation. They are already protected from others. And when we wear a mask, again, we're protecting others from us. Well, the healthcare workers are wearing a mask when they're coming in there. So in the hospital setting, they're not required to wear a mask. In a home health and hospice setting, when the patient is not with a home health provider, they wouldn't need to wear a mask. But when a home health provider comes in, it would be helpful for that person to be wearing a mask when the home health provider comes in to, again, protect the home health provider. So we're still trying to protect healthcare workers. So I'm going to go back at the end to remember, stay safe, watch out for others, please wear a mask. You're protecting others. It's not a burden to wear a mask. It gets a little hot, but really it's a small ask so we can continue to move forward. So have a good weekend. We'll talk to you on Monday. Thanks, bye.